Medications treat many elements of attention deficit disorder, but not all.
There's something called executive functioning, which is a fancy term in neuropsychology, which just means how you organize, plan, strategize. That's executive functioning. Folks with ADD often struggle with that. Not all of them, but on testing, that's something else we pick up very clearly. And we also know that medication doesn't address that very well.
But Mary Hurwitz does address that. She's a coach who works with ADD patients.
Basically guides them, helps them with structure and building systems so that they can function better in the workplace or in their own lives.
Mary was diagnosed with ADD herself just a few years ago.
I'm one of those people who's always doing it at the last minute. When I was in grad school in Texas, my husband was driving me to my final exam, and I was in the back seat typing my thesis, my paper. So that's not an unusual occurrence for me. And what happens is that gets old.
She learned to manage her ADD and now helps others, including those learning to cope with ADD in retirement.
You've been able to stay afloat, if you will, because you had structure in your work. Now you're retired, and they say, oh, aren't you lucky? You've got your days to yourself. Well, that's like, being adrift in a sea for someone who has significant ADHD without structure. We need structure. So we have to go and find structure for ourselves.
Do what I do right after I do it.
Neuropsychological testing can actually help the coach develop a system that works for that particular person.
If they're more visual, then a lot of Post-it notes or having something that has a lot of color attached to it works. If they're more auditory, and we're working on working memory so they can remember short term, to have a small little recorder. There's so many of them now out there. They're wonderful. How's the day planner coming? Were you able to get your appointments in there this week so far?
Mary will stay in touch with clients through phone calls and email, helping them fine-tune systems until they become useful habits.
There's a certain cheerleading piece that comes in there, and I hesitate using that word because it sounds sort of fluff and not serious enough. But in fact, we need someone who is not going to be critical, and that's a role of the coach, is being objective and not critical.
One common characteristic of people with ADD is continually being late. Time is always an issue.
Time seems to be a real factor for many of us and gets us into a lot of trouble.
Ed Popper is familiar with that.
Just the fluidity of time. I don't have to leave for there yet. And one of my characteristics that's been really tough to break is being late to things, because I don't leave until it's time. Often don't leave till it's time to be there. Missed a couple of planes that way.
He's learned to use a personal organizer and computer pop-ups to help him stay on schedule. Others will use timers and alarms and often have clocks in every room. It's often difficult to change a lifetime of habits, but a little coaching can make a big difference.
You can't underestimate the power of a successful moment.